Our vision is to deliver a safe, sustainable, world-class national service for children and young people with cancer. We want all young patients with cancer to receive the right diagnosis and be treated with the right treatment by the right team in the right place on their cancer journey. Around 150 children are diagnosed per year, and the survival rate sits at an average of 85%. Our services in Aberdeen, Edinburgh and Glasgow take a lead on the child's treatment, but also share their care with Inverness, Dundee and Dumfries. Attendance at any other hospital can occur in an emergency. Most children will have a central venous line and are seen weekly, either as an outpatient or at home by a paediatric oncology outreach nurse specialist. The outreach nurse specialist is their key worker, and your main point of contact is the link between the hospital and the community. All patients on chemotherapy are immunocompromised and therefore at risk of neutropenic sepsis. A child who is unwell or hot to 38 degrees Celsius or above must attend hospital immediately to start on intravenous antibiotics within an hour of arrival. They will have direct access back to their nearest cancer treatment centre. During treatment and for 6 months after treatment, they do not get any immunisations except the inactivated flu jab. We must also know if they have had direct contact with anyone with a childhood infectious disease, such as chickenpox. Schools and nurseries are contacted about this. If the child progresses on to palliative care, they have the option of care at home, in hospital, or at one of the 2 children's hospices. When a child has finished treatment, the community link is an aftercare nurse specialist. They are based in Glasgow or Edinburgh and offer a pan-Scotland service. Aftercare nurses monitor the health and psychosocial needs of patients and gradually encourage a shift from medically focused care towards a more holistic and individualised care. Late diagnosis within the UK continues to be a serious concern. If a child or young person you are seeing is not following the normal path of recovery, encourage them to seek medical advice right away. There is a module to recognise the early signs of cancer in this age group on the CCLG website. Cancer in the teenager and young adult age group incorporates the late onset of paediatric tumours and early onset of adult tumours. Some tumours are adult diseases presenting at an early age. The spectrum of cancers diagnosed in this age range is unique. There is no other age group that has a similar pattern, and evidence suggests that types of cancers occurring are biologically different. Teenagers and young adults have psychosocial, medical, and informational needs which are very different to those of an adult or a child. Services are being developed through our network in collaboration with Teenage Cancer Trust. Our aim is to have a model of care where all young people, regardless of where they live, have access to cancer services. AHPs help with some of the problems that children and young people with cancer may have, either during or once treatment has finished. Cancer treatments and their side effects can have a significant impact on everyday life. For example, certain chemotherapy drugs can cause damage to your sensory nerves, causing muscle weakness, altered sensation, and pain, known as chemotherapy-induced peripheral neuropathy. AHP services can assess and provide support to help manage many of the known side effects of cancer treatment. Physiotherapists monitor children and young people at risk and provide advice and exercises to help. Amongst other side effects, steroid therapy can affect muscle strength and bone density. Physiotherapists can provide input and strategies to help with this. The dietitian helps maintain the nutritional status of patients as they go through their treatment. Apart from growth, a good nutritional status is also important to reduce the risk of infection, maximize treatment, and improve immunological status and aid quality of life. Occupational therapy can help people with cancer live their lives to the fullest, whatever stage they are in their cancer treatment and recovery. They can advise on school, leisure activities, and on maximising participation in daily life. Speech and language therapists help babies and children who have speech, language, communication, or feeding difficulties. We also work with children who require alternative and augmentative communication due to a change or deterioration in their language and communication skills. If you are seeing a child who is currently receiving treatment, they may be known to the AHPs at their tertiary centre. Every young person with a cancer diagnosis is allocated a CLIC Sergeant social worker. They will undertake an assessment to identify how best to work in partnership with the family. They will also provide practical, financial and emotional support where there is a child or young person with a cancer diagnosis. All primary treatment centres have access to clinical psychologists who specialise in working with children and young people with cancer. They use evidence-based therapies to support young people with significant difficulties, such as emotional distress or difficulty with coping. Some centres also have access to non-directive therapists who provide evidence-based therapies using art, play and music. Clinical psychologists undertake cognitive assessments where there are concerns around the impact of illness or treatment on learning, behaviour or skills, such as attention or memory. For the most part, access to clinical psychology services is by referral only. Play and health play assistants encourage and provide suitable activities for children and young people. Play activities are used as a tool to promote coping, an outlet for feelings of anger, to reduce anxiety, and to cope with new situations such as procedures. Youth support coordinators are funded by the Teenage Cancer Trust to provide tailored support to teenagers and young adults with cancer. Principal treatment centres have dedicated facilities for teenagers and young people. All patients also have access to a chaplain where they can share fears, concerns, hopes. They offer spiritual comfort and support.